Today, we have Dr. Chebil here with us to talk about myopia, or nearsightedness, when you can't see far away. I'm Anita, and this is Care Experts. Today we're talking about myopia with Dr. Alexandra Chebil, a Harvard-trained board-certified ophthalmologist. Thank you so much for joining us, Dr. Chebil.
Oh, thank you for having me, Anita.
So can you tell me what exactly is myopia and what causes it?
Myopia is the medical term for nearsightedness. Okay. So if a person can see up close without glasses, but they need glasses for driving, for seeing the TV, typically they are nearsighted or myopic.
So the opposite of myopia is hyperopia, correct?
Which is farsightedness.
Yeah, so people can see far but not up close.
Correct.
And what is happening in the eye? What's the difference between the two exactly?
Well, with myopia, the surface of the eye, which is called the cornea, that's the very front layer of your eye, it's typically too curved. It's too round, so it focuses the light inside your eye as opposed to having it projected back on the retina, which is the very posterior layer of your eye. So the cornea is too curved in myopia, and for hyperopia, which is farsightedness, it's the reverse. The cornea is actually too flat. And that's why you cannot focus on something up close.
Now, is myopia hereditary? If one of my parents were to wear glasses, does that mean I have more of a chance of having to need glasses or contacts too?
It's not automatically hereditary, not from parent to child. There are family histories of myopia, but you can have one person with glasses for driving and then nobody else in the family needs them. The only type of myopia that is hereditary is the really, really high prescriptions. Sometimes you see an entire family where the children start wearing glasses for distance vision when they're 5 years old, and that typically deteriorates quite rapidly. That's called high myopia or extreme myopia. It's very rare, though.
Are you more prone to myopia at certain ages?
Typically, as your body develops, puberty, adolescence, early teenagers, that's the usual age when people start wearing glasses for distance. So that would be kind of 5th, 6th grade.
Yeah, I think that's probably when I got glasses
there
around
you go.
then,
There you
6th
go.
or 7th grade. And how common is myopia?
It is the most common visual problem for people under the age of 45.
Okay.
So if you see somebody wearing glasses for driving and to see the board at school, they are typically, they're myopic.
And how exactly is it treated?
You can wear glasses or contacts. That's not a treatment, but that is a quick fix for it. That would help the child see the blackboard at school and to do sports. The actual only permanent treatment, or one of them, would be the refractive surgery, which is LASIK or PRK.
And in what cases are glasses the best course of treatment? I know you mentioned that if you're wearing glasses and you're a child, you're probably not a candidate for a refractive surgery.
Yes, exactly. You have to make sure that the person, of course, is 18 or over. That's the FDA requirement. And also very important that the vision is stable.
Okay.
So for a child, typically as they grow in puberty, adolescence, that the vision can change quite a bit, sometimes dramatically. So you have to be able to keep on top of it and do the regular eye exams and change the prescription as needed. So the easiest one would be glasses. And as they get older, as long as they're at a responsible age and they know how to take care of their vision and good hygiene, then contact lenses are an option for kids that are in sports or in performing arts, dancers, that type of thing.
And in what cases would surgery be the best course of treatment?
Well, if you can't wear glasses or you cannot wear the contact lenses, then laser eye surgery is certainly an excellent option. It's very safe as long as you're a good candidate for it.
We'll be back after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on myopia. So when is ortho-K or orthokeratology an option?
Orthokeratology is a technique that I have never been involved in. What it does, it is a hard contact lens that presses on your eye. You wear the contact lenses overnight, so it essentially presses the eye with the nearsightedness. The cornea is too steep, as I mentioned. So the orthokeratology contact lens puts pressure on your eye, so it reduces the curvature temporarily.
Okay.
So then when you wake up in the morning, you take the contact lenses out, the ortho-K lenses out, and you can see better, maybe 20/20. But it's a temporary thing. It's a question of a couple of hours. So you can imagine the cornea has been flattened.
Yeah.
And over the course of the day, the cornea is going to come back to its normal curvature. So you're going to lose the benefit of having the contact lens in. I don't do the procedure. I don't do orthokeratology. I believe it gives you a temporary fix. Maybe in a teenager, if the vision is changing quite a bit, it may be a good option before they jump into LASIK. But in somebody who's over the age of 25, go for the LASIK.
Now, can you treat myopia naturally? Are there ways?
There is no way to make your eye less flat naturally. Your eye has a built-in focusing ability to it. So with nearsighted people, the focusing point is anywhere from here to here. But there's no way that you can make your eye see better at a distance.
So what kind of financing options do you offer at the LASIK Center Medical Group?
Aside from credit cards, we also deal with the CareCredit credit card, which allows patients to finance the procedure over time. So it makes it affordable, and we try to offer the LASIK procedure for a wide range of people and make it happen.
Yeah, it's wonderful that there's so many different, financing options to help patients get the vision that they need and want.
Absolutely.
Yeah. So now we're going to do something fun. It's time for our rapid fire question called Myth or Fact. So I'm going to ask you a couple questions and you can tell me if they're myth or facts. So the first one, myth or fact, reading in the dark can damage your eyes. Because, I heard my parents say this to me all the time when I was growing up. So
That is a myth.
it's a myth?
Yes,
Okay.
absolutely. Doesn't harm your vision whatsoever.
Okay. So good to know. So when I was under the blanket reading Harry Potter,
No,
that
you
was
can-
just
yeah.
that was a myth. Okay. So myth or fact, sitting too close to the TV or computer is bad for your eyes.
At a certain age, it is. When you get into reading vision problems as you get older, it's not going to cause permanent eye problem, but it can cause eye strain, but no permanent damage.
So that's like a half fact, I guess, because it could strain your eye, but not necessarily.
It will not create permanent damage.
And now myth or fact, wearing eyeglasses that are too strong for you will damage your eyes.
That is a myth. It will not cause permanent damage. There again, it can give you eye strain. It's like looking through a telescope to see far away. You don't need to have glasses that are that strong. But your regular eye exams, you should be checking that to make sure that they're the proper prescription.
Well, thank you for clearing those up. And Dr. Chebil, it was wonderful just learning so much more about myopia from you. Thank you. Very informative.
Thank you, Anita.
Yeah. Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.